Hi, my name is Landon Rudy, and today we will be discussing knee meniscus tear and femoral bone contusions in a collegiate softball player. Some background. Two-thirds of meniscus injuries are medial, and only one-third of meniscus injuries occur inside of sports. Meniscus tearing can be treated surgically or non-surgically, and it increases the risk of knee osteoarthritis. Depending on the mechanism of injury, femoral bone contusions may be present. Pictured above or below these paragraphs is the distribution of medial and lateral meniscus in different ages. As you can see, the older they get, medial meniscus becomes more common. This level 1 case study will discuss and confirm previous published articles who suggest that non-surgical treatment of a meniscus tear is of equal value as surgical treatment, and that femoral bone contusion patterns line up with specific mechanism of injuries. The patient is a 20-year-old female NCAA D1 softball athlete. The patient was running bases in practice and during the process hyperextended her knee. She complained of deep knee pain and an absence of full knee extension. Upon referral and imaging, a diagnosis of a medial meniscus tear and a femoral bone contusion were concluded. Exam findings included pain with palpation, limited range of motion, and a negative tuning fork test. No special tests were performed due to pain. The patient took a non-surgical approach. The affected leg was immobilized with crutches and a knee brace for around a month. Cryotherapy and electrical stimulation were also used right around a month post-surgery. The patient was unable to contract their quadriceps until month 3 of the recovery process. Knee rehab was conducted once the quadricep contraction was reached. Progressions in rehab were made 5 months in, and scraping and stretching were performed 6 months in. Dryland workouts, underwater treadmill workouts, and treatments were performed until a full recovery 10 months post-injury. The outcome of the recovery process was a full recovery to sport activity. This lines up with Peterson et al. And Sanders et al. Peterson et al. Researched that non-surgical treatment had equal effects of surgical treatment for meniscus tears. Sanders et al. Determined certain patterns of bone contusion based off of the mechanism of injury. Pictured below is a picture of a kissing contusion, which is what the patient had, due to a hyperextension mechanism of injury. This is not the specific patient's X-ray. This level 1 case study confirms the literature behind the evidence that suggests non-surgical treatment of a meniscus tear is of equal value as surgical treatment of a meniscus tear, and that femoral bone contusions align with specific mechanisms of injuries. The clinical bottom line: if patient circumstance allow it, a non-surgical approach should be used for a meniscus tear. Thank you for listening.